Well, good afternoon. I'm really honored to have these great co-hosts with me today who are going to be talking about mental health and behavioral health. We're going to let a few people join on before we get started. But as we do, I'm going to just do a couple of reminders. One is that we're recording this session. So for folks who want to send this out, want to get some information, but also make sure you can share it with family and friends. We're gonna be able to do that. And then the other thing is that we're going to make sure that everybody who attends and everybody who registered will get all the slides that you see and a link to be able to review this at a later time if that's helpful to you. So today's focus, welcome everybody, will be to share behavioral health resources for adults and older adults. For those of you I haven't met, my name is Cindy Chavez. I'm on the Board of Supervisors, and I really am delighted to be here with you. We know that these are challenging times. All of us are suffering from challenging times. And one of the things that we hope comes out of today is that for all of you, that there are resources either for yourselves, your friends, your family, or your community, and that by getting this information, you're going to be able to share it. Before I turn it over to our experts, I just wanted to make an observation, and that is that, during these times, that one of the things I'm excited about, if there's anything to become, if there are positive things to come out of COVID-19, one of them is that because so many people in our community are really interested in behavioral health and mental health services, that perhaps this will help us address the stigma that comes from asking for help and will level for all of us the understanding that we need both support for medical, physical health and mental health, and that both should be priorities. So what I'm really excited about today is that we think that by the end of this session, you're going to be better equipped to share resources with the community and to know where to go to get the answers to the questions that you need. I'm really honored that we're joined by David Moneta. He's the CEO of Momentum for Mental Health, and also Margaret Ovalar, and I'm sorry, Margaret, I always say your last name wrong. I apologize. She's the director of our adult and older adult healthcare system for the county's behavioral health system. I'm really excited they're here with us. And what I want to do is I'm going to turn it over to David and to Margaret. I'm going to let them dive into their slides. Then we're going to open it up for questions, but feel free to put questions in the chat while this is ongoing, or in the Q&A. We will respond to them as quickly as we can. And I just wanted to also acknowledge that really it was David's idea that we make sure that we educate our community ambassadors and the community at large about what services were available. And I just want to thank him for being so thoughtful. And even as we're coming out of the pandemic, that these adjustments are going to cause, we think, perhaps cause people to have a greater need maybe than they even had before. So we recognize these are challenging times. We want to make sure you have the tools that you need to support and help your community. And again, I'm really grateful to both David and Margaret and to all of you for spending a Saturday afternoon with us. So with that, I'm going to turn it over to David Moneta.
Great, thank you. Thank you, Supervisor Chavez, and thank you very much for the supervisor's leadership actually to make this happen. I mean, it's one thing to come up with an idea. All of us come up with ideas every day. To actually make things happen, and I think that's what we're fortunate to have. Supervisor Chavez's leadership on the County Board of Supervisors is to actually make things happen. So for that, I just want to thank Cindy and also her staff. I want to thank Paul Murphy, and Alex Lynn, and then also Victor Perez for, again, that team making this happen. So with that, welcome everyone. It's good to see so many different, so many names, and some folks I think may have been on our earlier call for focusing on youth and young adults. So thank you for coming, for some of you for coming back for additional. Also, it's quite an honor to be on the panel with Dr. Margaret Ovalar, the Director of Older Adult Services for the Behavioral Health Services Department. And Margaret is very fortunate that Santa Clara County has her experience, working on these critical issues, especially expansion of services into older adults. And so this topic today is a very serious, vital, and important discussion on our county's mental well-being, and many of our neighbors and ourselves, our neighbors. The data nationally and locally highlight the impact that the pandemic has had on our mental health and mental well-being. Today's going to could be it's a serious discussion, and as well, there are a lot of concerns and worries and all. I think at the same time, we have to actually use our own sort of resiliency skills and coping and wellness skills so that we can get through this. So I think in some ways, we're going to be employing those today, those same skill sets today. So with that, let's go to our agenda. And our agenda looking at the general impacts of COVID-19 on our mental well-being, and then looking at how can we better protect our behavioral health and wellness for adults and older adults, and then finally looking at our behavioral health supports and services throughout the community. All right, next slide, please. So on the impacts of COVID-19, this slide just tries to summarize some of the different impact areas that, where our community members and our community is feeling, areas of impact. And so clearly for adults and older adults in particular, I know that isolation and connection has been one of the chief concerns for many of us. And for those of us who have older adults in our families during the pandemic, I know this is one of those areas that, and I don't know about many of you, but I try to call my mom every day. I talk to her every day. Pre-pandemic, we weren't talking ever. I wasn't calling her every day. And just the worry about fears and concerns, finances, job losses, health, uncertainty. I mean, just reading that list brings some level of anxiety at all. So I think that, again, just this increasing and significant increases in our fears and daily fears and concerns. Technology needs. There's been a premium on virtual access, education, equipment access. It's turned almost overnight last year, and our dependence and need on our technology. And then how all this then connects to our behavioral health needs throughout the community. Again, these are just some areas, but what this has created now for us is what the federal government has been actually studying, and many different research arms and also healthcare researchers are looking at are what have been the health impacts from the pandemic and all of these worries and fears and isolation and all. One of the things that the federal government was documenting was as early as June of last year, as they were seeing elevated levels of adverse mental health conditions, substance use, and suicidal ideation by adults across the country. The prevalence of symptoms of anxiety disorder was approximately 3 times those reported in the second quarter of 2019, 25% versus 8% in 2019. And prevalence of depressive disorder was approximately 4 times that reported in the second quarter of 2019. Again, 24% versus 6.5%. Suicidal ideation was also elevated. Approximately twice as many respondents reported serious consideration of suicide in the previous 30 days than did adults in the United States in 2018, referring to the previous 12 months, 10 almost 11% versus a little over 4%. Again, CDC was reporting that mental health conditions have been disproportionately affecting specific populations. We know that the impact has been across all demographics, right? Including age, region, demographic, socioeconomic status. So it's impacted everyone, and then it's impacted some communities even more. And CDC again reporting that especially young adults, Latinx persons, African Americans, essential workers, unpaid caregivers for adults, and those receiving treatment for pre-existing psychiatric conditions. And this was, again, this is in some ways what a lot of the behavioral health providers are finding now, and through the pandemic, through the first year of shelter in place, is that folks with pre-existing psychiatric and mental health conditions were really feeling our shelter in place orders and the isolation and all the things we were doing to try to be safe and healthy regarding the actual the virus itself. So again, we just wanted to sort of point out some of these impacts, and that again, the government and CDC, SAMHSA, and NIH have been following and those statistics. Next slide, please. The good news is, as Cindy likes to say, and I think she helps sort of, float my boat on days that are sometimes difficult, but that again, there are many things that we are learning that are sort of positive and being sort of reinforced, certain positive messages during the pandemic. And one of them, I think, has been around how to process stress and emotions in really positive ways, in very intentional ways, I would say. And this slide is about, and you'll get these slides, everyone, you'll get these slides later from Cindy's office, from Supervisor Chavez's office and staff. But these are really important, I think, methods of trying to de-stress and stay positive and stay as resilient as we can. And so I don't, just to pick a couple, I just, right now, being around people who are positive, by Zoom, by phone, text, I would include all of you today, and Supervisor Chavez, her staff, and Dr. Obelar, just that, being around positive folks, folks that want to help and care about each other and care for others. Again, in the many different ways that people are using their own self-care methods, and if I could also I just would stress that, to break it just to be as simple as possible, getting sleep, getting the right amount of sleep, eating well, and exercising, getting outdoors now, super helpful, and something that always the treatment programs are always trying to stress in either outpatient and residential programs. Next is Dr. Obelar will now discuss, again, some of the contact numbers and where people can go and connect for assistance. And then we'll also talk about answer questions after her presentation.
Good afternoon, everyone. Thank you, David, for giving us that overview on COVID and the pandemic. So the rest of my slides, like David had mentioned, will be focused a lot more on local resources and behavioral health services that are available for adults and older adults in the community. I want to start with the local resource. And as you can see on this slide, we do have the behavioral health crisis, suicide and crisis line, right? This is our suicide and hotline that you could call in. We have the crisis support via text. We have our mobile crisis response that goes out in the community to engage individuals who are going through mental health or behavioral health related crisis. We also have a mobile crisis response team for children and youth that it's operated through Uplift. You can also call our behavioral health call center to access services, or you can call Gateway to access substance use treatment. We also have a different line for youth substance use treatment, both for Monday to Friday and for after hours. Facebook, Santa Clara County Facebook Live has a lot of information there, as well as the National Child Traumatic Stress Network. So these are a lot of the local resources that are out there in the community. Next slide, please. Wanted to really state a little bit more about mobile crisis response for adults and older adults. And this is really a program that has been running now for quite a little bit, I think almost 2 years. And this program really, you can access this through calling our behavioral health our behavioral health call center, and it's the 1-800-704 number. You press option 2 and you will get a live person who will be able to respond to you, at least talk to you, get a sense of what's going on, even for your family member. And eventually we'll deploy a group of clinicians to go out in the community to assist manage the situation. In some instances, they will work together and in collaboration with our law enforcement liaisons in order to help address the behavioral health crisis issues that you may be experiencing. Next slide, please. So we put in this one because, like David had mentioned, there are a lot of stress going on wrong right now as a result of the, not just the COVID, but also other stressful situations, right? There was a period of time when there was fires. When the rains came, we had flooding and storm. And so all of these caused a lot of stress in various areas of our lives. And so really in trying to cope with stress, it is very good to really be well informed. And I really thank Supervisor Chavez for organizing activities like this in collaboration with us and David Mineta, in order to give you, the community, a lot more information and resources that are available out there in the community, in order to help you also kind of address all of these very stressful times. So it's really a good idea to be informed. So those of you who are participating, very good. Stay connected with friends, families, and community groups, because we also know that as human beings, we are very social and we enjoy being around others. And we know that during this stressful time, you don't get the opportunity to be with others, but from other ways of really connecting on the phone or through other methods that really helps you to stay connected with friends. Keep a positive attitude. I know sometimes in these trying times, it could be hard to be positive, but look for things that make you happy and look for ways that you can, help others, because sometimes we all enjoy that type of, we enjoy ourselves by taking care of others, or by actually volunteering and doing other types of things that gives us pleasure and pride. So really trying to cope with stress is something. And then for some of you who, maybe grandparents who are taking care or helping to support your adult children's children. We also want to make sure that you have resources to help support those children as well. Because again, we as adults, how we're feeling sometimes affects the children, and it's good to help the children to continue to connect in ways possible. Next slide, please. I wanted to also give you other tidbits that are out there. Crisis hotlines. We have the California All Resources for Emotional Support. So for those of you who don't live in Santa Clara County, this is another hotline that you can access regardless of where you are. It's a 1-800 number. We also have the Suicide Prevention Lifeline. We have the California Mental Health Services Authority, and also the California Parent and Youth Helpline. So these are all different crisis hotlines to help reach you regardless of, you know, what generation you fall into, and regardless of what type of supports that you're needing. So if you're needing emotional support, that, you know, you're able to access these hotlines that would really help manage and give you guidance, and also give you more resources and tools to help continue to manage these activities that are going on, and, you know, the concerns that we have in the community. Next slide, please. So with behavioral health, our behavioral health is really focused on the public. It is a public health system. And part of our goal is really to make sure that we provide physical and emotional support to you know, our community. We also strive to make sure there's a safe and permanent living situation, that you are part of a supportive network, right? So either social network or any other type of network that gives you pleasure. We also want to make sure that you have meaningful school and work activities, as well as you're safe in the community here where you live. Our mission is really to provide quality of care, and we try to do that as much as possible in a very, very least restrictive environment, right? We want to make sure it's non-stigmatizing, and that you have access to all the coordinated services and systems that we have within the community. Self-care is very important to us, for respect for your family, for your loved ones, for, you know, respect for language, culture, ethnicity, your gender and sexual identity. And you will see this in the next couple of slides in terms of just the services we provide is really to make sure we engage different members of the community, regardless of your cultural background or your ethnicity and all of that. Next slide, please. So the behavioral health department within the county here offers several services for both the adult and the older adults system of care. And our services range from high intensive outpatient services that includes full services partnership, that includes both specific for older adults as well as for adults. And we also have various other programs within for individuals who are justice involved. We have several even the faith-based resource center to help kind of manage those individuals who are still very spiritual and need that spiritual guidance as a way to manage some of the things going on in their lives. We have substance abuse services. We have both residential services, outpatient types of services, all of it to address any form of substance related types of issues any individual may be encountering. We also have substance use treatment, which is the medication assisted treatment, whereby we sometimes use medication, right, to help support your substance use health in order for you to get better, more of a harm reduction model. And then we have methadone, Suboxone, Vivitrol, naloxone, counseling-related types of services to help individuals manage those types of stress and issues going on with addictions. We partner with our primary care behavioral health settings. We've also gone in the inpatient routes. All of these are ways for us to continue to help an individual who's suffering from any form of substance use related issues to address their concerns and to address that need. And eventually, of course, the goal is to stop using. Next slide, please. Then we have some other programs which we refer to as specialty or special services, right? And this is, one of them is Q Corner. So we have a resource center where we, individuals who are LGBTQ related services, and people can drop into that center as well. We partner very closely with the primary care behavioral health, and we partner a lot with a lot of the VMC health centers. We have a behavioral health staff person, a social worker, and a psychologist embedded in those services. We also have the psychiatric emergency response team. This is another team that is being developed that would also help to assist individuals out there in the community. This team will be working very closely with the police in this regard. We have a peer support system. Peers are very involved in a coordinated system of care, and they are embedded into our outpatient services, and they help, and they're also in the community within all the various cultures, trying to outreach to folks and help build that relationship and build the support for the peers who may be struggling with, who may continue to struggle and need that assistance. We use the video simulation types of training to help also train law enforcement agencies so that they can work much better with individuals who are suffering from mental health related issues. And of course, finally, we have supportive housing services. Many of you know how hard it is in the county with the cost of living increase and all of that. So we work very closely with our Office of Supportive Housing, and we provide a lot of mental health services within that. We try and help connect people to benefits. And then we also have services that we partner with the primary care places to provide that support. Next slide, please. So how are we providing behavioral health services in this time of COVID? We've really adopted a different model whereby we do some form of telehealth, where it's either over the phone or the video types of services. We also continue to have some in-home services, whereby not in-home, sorry, but in-person services. So whereby if an individual really prefers to come into the to the office to see the therapist, or the therapist can meet with the individual out in the community in an open space. We've also shortened therapy and activities that we provide with individuals, because we know, especially for the older adults, that being on the phone for an extended period of time could be very overwhelming. And so what we've done is to shorten those therapy sessions to either 30 minutes or less, and have them more frequently during the week. We've also increased the frequency and have been doing a lot more care packages to help support individuals out there in the community. So our interventions have really been about instilling hope in our clients and letting folks know that, we're here to support you as much as possible. We're trying to help you to really identify your natural supports out there in the community, build more relationship. We found out like keeping routine helps. So if there's certain things that you're doing and you're doing them more regularly, it helps you stay focused and gives you a little bit more structure. We've also tried to embed the idea of spending time with family. We know it's hard during this COVID situation to spend time, but do it in other forms. Call folks, like David said, he calls his parents more often now than not, so there are other ways we could do video chats, rather than actually going out there in person. We also have created a lot more mental health awareness days and this is like one of them, so that you get to understand a little bit more some of those ways of just being informed and managing your mental health better. Talk to someone if you're concerned, write a journal. Some people like to write, and this is an opportunity for you to do more writing and self-regulate. And then of course, if you can, meditate. There's so many different meditation tapes now out there that you can get online that will just kind of help you relax and at the same time reduce your anxiety and stress. Next slide, please. So we work very closely with the Department of Aging and Adult Services and felt it was necessary to really include some resources here for you so that you would, especially for our older adult folks, even in the behavioral health side, we've added a peer respite program, which is really for our older adults and for the caregivers to help provide the caregivers a little bit more relief. We understand that during this time of COVID and during a pandemic, or even when there's an outbreak of infectious diseases, it is hard for folks to really know about the resources out there. So in this particular situation, so meals and services are still available. Senior nutrition program is still available. So a lot of these senior nutrition places have partnered with some community-based organizations, and they're providing meals and resources to folks out there in the community center. So our older adults can go out to this place and they can actually, you don't necessarily have to go out here. You can get the meal also delivered to you. There's also takeout meals in some of these other areas. And the here for you to, so there's Meals on Wheels as well, where meals are delivered to your home. And if you call this 48350 number and you put in option 4, you can get the meal delivered to your home. Next slide, please. We added also the mobile vaccine unit, and this is available for older adults who are homebound. You don't actually need to be an older adult. Anyone who's homebound can actually get their vaccines by registering through the COVID Vax home email. You can email this particular place through the public health department, or you can actually call the 4089702818 number and call them, let them know you are homebound and you're not able to come out or leave your home, and they would make arrangements to come out there and give you the vaccine. So these are all various other resources that are available to everyone out there in the community, regardless of where you are in terms of what's going on with you, that you are able to access vaccination in different forms. So those of you who are homebound to take advantage of this, or if you have a family member who's homebound, they could still get their vaccine. Next slide, please. Great, so this is the end of the resources and my presentation here. And for additional information, you can contact Paul Murphy. Thank you.
Well, thank you so much. That was a lot of really helpful information. And what I will do is just go to the community and see if there are any questions or comments that folks have. And I'll start with Arthur.
I'd like to know whether there is a universal screening for healthcare for mental health conditions. And I'd like to see that such screening occur.
Dr. Obalor, this was a thought that Arthur had about doing more mental health screenings when people go in, even for their regular doctor's appointments. Is that right, Arthur?
That's right.
And your thoughts on that and what we do in that area now?
So we don't have a screening set up in that format, but the general physicians do have screening tools. I know we have it for the children. I don't believe we have it for the adults. And I mean, I can check into how we're doing that now. Because most of our referrals is mostly through our call center. They're the ones who do those screenings, and then they assign or refer individuals to any of our outpatient programs.
A lot of the outpatients, a lot of the people don't call screening, they suffer in silence. And you got to outreach to them by asking them if they have an issue deliberately.
It's a good thought. Go ahead, Dave.
Yeah, you know, I know that Arthur, that this came up in the, you brought up in the last, and it was a good point then. It's a good point now. You know, the thing on the universal screening is that I think, in some ways, I think because of clients, I mean, clients who are in the public insurance side coming under Medicaid, Medi-Cal in California, that you know, it feels to me it's a policy decision that given the nature of our behavioral health concerns overall across all age groups, you know, it seemed like it's a timely policy discussion at all to have with the feds and, you know, either local electeds and CMS in particular.
Well, I think that our clinics should be set up to ask to do their own screening. Every time you go into the doctor's office, you would be screened.
Right. I would just say the mechanism to, you know, and I'm not sure of the mechanism of, you know, to pay for the screening time. My understanding was, at least with kids, that was being worked out pre-pandemic. I'm not sure what the status is, and since we have been discussing this on the first call, I have emailed Santa Clara Family Health Plan to follow up with them and their chief medical officer to see what, just to find out what it is they were asking of their pediatricians on the well visits. But I think on the adults as well. I mean, I think the concern here as well is that more and more seniors are suffering in that same silence. You know, how would we know?
That's right. How do we know?
Yep. So
it'd be good if people could be screened in advance before they go into the appointment, so that they don't have to waste the doctor's time on wellness. They could waste the doctor's time on treating them.
Yep.
Yeah, I mean, I think so too, Arthur. I appreciate that. I also think that, you know, these are important questions. And like I said, we use a screening tool now, almost every healthcare institution I know of, around domestic violence, and it's a pretty quick series of questions. We also use screens for other, when there is another type of concern that the doctor has. And one other thing I would say, even as we think about this beforehand option, I think some of it can be done through technology, and some of it still requires, you know, human interaction that's more face-to-face. But I think you've raised some good questions, and I'll be thinking more about that. So thank you for that.
Thank you.
We also have a question from Barbara Estrada about what are the requirements for Meals on Wheels, and I'll have my staff put a phone number in the chat, and we can also I'll just ask the staff if we can find a link to Meals on Wheels that might make it easier to do the assessments for folks, so Barbara would know who she can send there. Is there are there any other questions or comments that folks have that they want to make sure we can address today? I don't see any other hands up or questions in the chat. All right. So, so I wanted to say a very special thank you, David, to you and to Dr. Obalor, and just said thank you both for spending time with us today. We'll make sure everybody who signed up has the slides for today, because we know that's really important information, and a link to this conversation so that you're able to share it. I also just want to say that, you know, I am really grateful to the group of you who've joined us, to these mental health professionals, and really thank you for acting as a bridge to our communities, to the services that they need and richly deserve. I also just want to thank all of you who are community ambassadors, and just to say it's really important work. There's a lot of information that people are getting, and they need trusted sources of information. So you are trusted sources. And I just wanted to make sure I had a very special thank you. And David, again, thanks for your inspiration. And Dr. Obalor, thanks for all the good work you do. And I will look forward to getting a chance to, you know, do some deep breathing and a little bit of meditation after this. So thanks all. Be well, be safe.